all the time and telling them how wrong this is. Another member of the coalition is the Colorado Progressive Coalition. They've been part of the coalition to end the war in Iraq. And our next speaker is Jane, and she's representing Colorado Progressive Action, and she's Jane Fuestal, community organizer for Colorado Progressive Action, the lobbying arm of the Colorado Progressive Coalition. And she's going to be talking about another real concern. If we weren't spending this much money on the war, there's one other real important thing that we could be spending it on. Here's Jane.
Hi, thanks for the opportunity to speak. My name is Jane Fuestal. I'm with Colorado Progressive Action. We are the lobbying arm of Colorado Progressive Coalition. We're a statewide membership organization with over 4,800 members. We work on social justice, civil rights, keeping our elected officials accountable, and winning progressive public policies. And this last year, we've been focusing on a lot on two issues: ending the war in Iraq and healthcare and health justice in this country. And we really think the way that these two issues have been addressed really sheds light on the misplaced priorities of this country's administration. Yeah. So first I'm going to talk about healthcare, and in particular because of the timeliness of the issue, I'm going to talk about the State Children's Health Insurance Program, SCHIP, or CHIP Plus as it is in Colorado. So recently this program has been the victim of partisan political play and has reminded us of the sick and twisted agenda of some of those on Capitol Hill. So in September, Congress passed a bipartisan compromise bill to reauthorize and expand SCHIP, hoping to make at least a small dent in the outrageously high number of uninsured children we have in this country, 180,000 in Colorado alone. So Bush heartlessly vetoed the bill and showed his complete disregard for these 10 million children who depend on SCHIP for vital services, including immunizations, regular checkups, and things like dental care, things that all of our children should have. And so while helping to rally support for SCHIP, I've had the opportunity and privilege to meet families who depend on this effective program for the health and lives of their children. So one mother I met recently, she already works 2 jobs to support her 3 children, 2 of which have severe health problems. So if and when SCHIP is vetoed yet again by the president, and if the program actually expires, she'll be forced into making choices no one should have to make. Do I put food on the table, or do I pay the medical bills? Do I pay rent, or do I buy the prescriptions that my kids need? And those are unacceptable questions that no one should have to face in this country. Yeah. And so for other kids, like 2-year-old Bethany, who was born with holes in her heart, SCHIP has been a literal lifeline. And without it, her parents have no idea how they would afford her expensive care. And so without the reauthorization and expansion of SCHIP, this healthcare crisis will continue to grow. The rates of children who utilize the emergency room for their medical needs will increase dramatically because they just simply won't have access to any preventative care. And the high cost of these visits will then be passed along to taxpayers. So what does that say about fiscal responsibility, right? So Bush and Colorado's Congress people Musgrave, Lamborn, and Tancredo, and they've all continued to oppose health care for our kids. And all are proclaimed advocates of family values. But what kind of family values is it to put the interest of profiteering insurance companies above the needs of our children? Or better yet, what kind of morality and value system is expressed when Bush and his rubber stamp representatives can approve $500 billion for the death and destruction in Iraq, but they refuse to support an effective kids' health program that only costs $35 billion? So it's time that they stop prioritizing greed, profit, and world domination. It needs to end. And voting for SCHIP would have been an investment in our children and the future of our country. So much for family values. Thank you.
Thank you, Jane.